Hi, my name is Stewart. I'm a neurologist at Emory University and director of the Movement Disorder Program in the Brain Health Center. And I'm very happy to be here to be partnering with the Miracle for Mom Foundation, which is a very important supporter of research in neurodegenerative diseases. I thought today we would just talk about some of these Parkinsonian disorders and how difficult it can be for them to be diagnosed and what directions we're going in, and also say a little bit about treatment as it stands right now. So when we say Parkinsonism represents a series of symptoms that is similar to Parkinson's disease, but can be present in many diseases that are called progressive supranuclear palsy, multiple system atrophy, corticobasal degeneration, Lewy body dementia, and others. And there are even drugs that can cause Parkinsonism. People can have Parkinsonism from strokes and a variety of other things. So it's very important when you're thinking about treating patients to make a proper diagnosis. And right now, the diagnosis is made clinically, and it's very important for people to see an expert in the field to be able to try and differentiate these disorders, but it can take even years before you know exactly what might be going on. In research today, one of the big directions is in what we call biomarkers. These are biological measures of disease that can be used for making a diagnosis and also for measuring progression of disease. The biomarkers will be used in clinical trials when they're developed. Biomarkers are measured through certain ways. One is imaging. There are MRI images and PET images. PET is positron emission tomography that look at metabolism. And they have certain fingerprints for diseases, and these are being developed for use in practice to make an appropriate diagnosis at an earlier time. There are also spinal fluid biomarkers. Patients would have a spinal tap or a lumbar puncture where we remove fluid. This is a standard test that's done in neurologic patients, especially needed for diagnosis in multiple sclerosis, for instance. And now we're starting to find certain proteins within the fluid that may be helpful in differentiating these diseases. And I think the next few years we'll find that there'll be a standardized panel of tests for that. Once we make the diagnoses, you should know that it's not just a motor disease. It's not just tremor and walking and stiffness, but these patients have multiple areas of problems. And so in our clinic, what we do is we have patients seen and have their cognition evaluated. They're seen by a psychiatrist. They're seen by a geriatrician who looks at blood pressure changes, bowel and bladder functions, and we try to provide a more comprehensive plan for patients in treating these disorders. So it's worthwhile to find a specialty clinic that can help with these areas for you and try to make the diagnosis and treatment more clear. Stay tuned for our next update, which will be more research driven. Thank you.